Coming up, we'll be on location in Germantown, Maryland at Capital Neurology and Sleep Medicine, discussing some of the latest advances and treatments available within neurology and sleep medicine with one of this area's top doctors, Dr. Syed Ahmed. We're here at Capital Neurology and Sleep Medicine in Germantown, Maryland, discussing some of the latest advances in neurology and sleep medicine and treatments for sleep apnea and other sleep disorders that so many people suffer from. We want to welcome you, Dr. Ahmed, to the Top Doctors Interviews. We're proud and excited about featuring you today.
It's my pleasure. Thank you for having me.
All right. I'd like to begin by asking you if you can please tell us what neurology is for those of us who don't know.
So neurology is a specialty in medicine that treats the underlying brain and nervous system, and we manage, we treat, we have a planned care to treat patients with all sorts of brain and spine disorders.
Oh, okay. And what types of health problems does it typically address?
In particular, in our office, one of the most common issues that patients come in is all different types of headaches, but neurology, of course, involves treating patients with multiple sclerosis and seizure disorders or epilepsy and Parkinson's and memory and cognitive issues as well as dementia. We also have a lot more concussion patients. So we treat anything that involves the brain and including the spinal cord system. Numbness and tingling that patients present with as well.
Oh, so these are problems and issues that so many people suffer from, and it can really address and help people improve their lives, eliminate the pain, help people sleep better. And so, Dr. Ahmed, what are some of the latest treatment options that are available to treat these issues?
For example, with migraines, we have patients who come in with very debilitating migraines. They're missing time from work or time with their family, requiring ER visits. So we have now offer Botox therapy for migraines, and they get that every 3 months. That's quite effective. There are also monthly injections that we can get that are new to the market to help with these patients with these chronic migraines. As far as epilepsy and multiple sclerosis, there are many new drugs that have reached the market that can help.
And Dr. Ahmed, are these treatments and procedures performed here at your practice, or do people have to go to a hospital?
No, these procedures are performed here in our office in Germantown, Maryland.
Okay, and they're so basically where they can come in, have the treatment or procedure done and go back to work, or does it take a long time?
No, I mean, usually they're out within 30 minutes and they can return to work or home.
All right, that's good to know. What are some of the patient benefits as opposed to the more traditional treatment options with these new advances?
Well, with the new migraine advances, patients are now able to live a more fulfilling life. They're not always scared about having a headache or carrying pills in their pockets. It just brings back freedom in their life because they're not always in pain.
That makes life a lot better and people a lot happier. So definitely great to know that these options do exist for people.
Yeah, and with the underlying stress with the COVID, so we've been having a lot more patients come in with headaches and pain.
Yeah, I mean, I can understand because the pandemic has affected so many people and puts a lot of stress on people. So it can make a lot of these symptoms worse and make their lives a lot more difficult. So having these options is definitely something that can help a lot of people, especially during this pandemic as well.
Yes, that's correct.
All right. And how many treatment options are typically necessary? I know it varies depending on the health issue or health problem, but how many would you say in general?
Yes, so for example, if it was for chronic migraines, you would come in the office every 3 months to get Botox therapy. For other conditions, it can vary. But for migraines, it's probably every 3 months.
About every 3 months. And what types of results are your patients seeing from these treatments?
So our goal is at least a 50% reduction in their headaches and pain. We typically get much higher numbers than that.
Wow, that's very impressive.
Thank you.
So are these treatment options something that can offer permanent results, or are these recurring issues that patients would have to continue to get treatments for the rest of their life?
I hate to use the term the rest of their life because, for example, with headaches and migraines and pain. There are different variabilities that can change how frequent you have it, but it is long-term therapy for maybe several years, which is not permanent, but it can really make a big difference.
Oh yeah, because some of these problems, like you said, migraines can be very debilitating to people and really affect every day an aspect of their life. So to have the migraine treated and not to have to deal with the pain and suffering is a huge benefit.
Yes, and I just don't also want to do in medication treatments. I also really focus on their quality of life. What is their nutrition? Are they getting adequate sleep? As being a sleep specialist, that's very important to me. Are they managing their stress? Are they getting enough fluid intake? Because with pain, with headaches, there are many, many triggers.
That's a great point. People don't realize that it's not just one thing that can cause the issue. All aspects of our life, our diet, our nutrition, how much sleep we get, play a role in that. And the fact that you can sit down and you take the time with each patient, because we've spoken to patients, they love you, you've done a great job with them, they're really pleased with the results and how you take the time to understand every aspect of their life so you can put the best plan together for them.
Absolutely. We want to do more than just the traditional approach. We want to do an integrative approach, which includes classic traditional medicine with also lifestyle modification.
And that's a great way to get optimal results for each patient.
Yes.
You also offer sleep medicine that you touched on earlier. Can you tell us a little bit more about the sleep medicine treatments that you do here?
Yeah, so I'm qualified as a board-certified neurologist and a sleep medicine specialist. So we integrate our treatment of sleep with our neurology practice, which is very rare. For example, if a patient comes in and they're having headaches, I always find out how their sleep is. Are they having a hard time falling asleep, maintaining their sleep? Are they snoring? Are they fatigued during the day? Because that can definitely contribute to their neurologic symptoms.
And what are some of the most common sleep disorder problems that you see in patients?
Typically, the most common sleep disorder problem is obstructive sleep apnea. That is associated with increased risk for hypertension, heart disease, stroke, can worsen your diabetes, and obviously causes fatigue during the day and poor work performance and cognitive issues. But with COVID, we're also seeing a lot of patients who say they can't sleep. They're stressed. They're managing their kids at home, so we're seeing a lot of insomnia as well.
So these are things that are really important to get checked out. They can have very adverse effects, like you mentioned, to affect our health, even cause death. We've heard of sleep apnea causing the death of famous athletes like Reggie White and others. So it's definitely something that needs to be looked into, and the options that you offer are very effective to help them get a good night's sleep and restore their health. What's the patient process for a patient that is suffering from sleep disorders, different types of problems, maybe sleep apnea? When they come in to see you, what happens from that point?
That's interesting how you're saying from the cardiac point of view. One of our biggest referrals are cardiologists. They send patients here to be evaluated for your sleep. Typically, we take a detailed history. We find out how their nutrition is. Are they overweight? Going back to being more integrative. I always counsel them if there's ways that we can help get them to a proper BMI and focus on their nutrition. Then, which is unique to our practice, they can do their sleep studies at home. So we give them an apparatus, a medical device that can test their sleep at home.
That's very convenient to be able to have the device at your own home, and you don't have to, go into a hospital or another place. It makes it a lot easier for patients.
Absolutely, and now with COVID, it's much more comfortable getting testing done at home.
And a lot more safer as well.
Yeah.
And how effective are some of these treatment options that you spoke of?
Well, if you're willing to use a CPAP machine, which I obviously do think I recommend, that's the gold standard. That's 100% effective. There are also appliances that you can put in their mouth. Very rarely there can be surgeries. And also, if you can lose about 10% of body weight, that can make a huge difference with things with sleep apnea. As far as the insomnia goes, we do have to do medications at times, but I focus on sleep schedule and regular exercise, again, nutrition, and even meditation to kind of calm your body down and have the right sleep practices before bedtime.
I love the integrative approach because it can help so many people. I mean, we know that sleep is a big problem here in the United States and all over the world, and there's so many prescriptions and medications out there that people use as a Band-Aid just to help them go to sleep. But to be able to address the problem and actually do it in an integrative, holistic way that improves your health and wellness is really great.
Yeah, I think now with the way medicine is moving, if we can have a more integrative approach, I think there's a lot of value in that. I mean, for example, I even use supplements. We sometimes prescribe patients magnesium. It can help with their sleep, muscle spasm. It can even help immensely with their headaches. We've also brought a rehab doctor on board, Dr. Adnan Siddiqui, to help our patients with post-stroke, to help with their rehab. So we are really trying to grow a multi-specialty group.
I think that's to the patient's benefit because you're able to offer the different aspects that all affect their issue and help them resolve their health issues. You guys work together, you communicate within the same practice, providing, again, optimum results for the patients.
And I'm very lucky that I have a couple other providers in our group that are fantastic clinicians. One is Dr. Zakia Wynn. She's a cognitive specialist. We were fortunate to have her on board, as well as Mary Ferda, our physician's assistant. So when you come into our office between Dr. Wynn and Mary Ferda and Dr. Adnan Siddiqui, you're going to be in great hands. And we all practice, number one, most important, we really care for our patients, and we do also offer an integrative approach.
Yeah, I'd like you to touch on that a little bit more because you're very unique throughout the region. First of all, you're recognized as one of this area's top doctors. We're really excited to have you with us today, informing us about so many different treatment options and advances in sleep medicine and neurology. But I wanted to ask you what your vision was to set up this integrative practice and how it's different from a lot of the other practices in the area.
I think the most important thing as a clinician is to really care. Our office manager, our staff, we always care. We show that when you walk into the office. Then we determine, is this a patient that would benefit from more of an integrative approach or more a traditional approach? But I think the number one thing is patients, when they're here, they feel comfortable that they're in good hands and that we really do try to make their experience good. We know they're in pain, they're suffering, and we really want to help them.
Well, that's great to know. And again, we did hear from some of your patients, and the patients were ecstatic about not only the results of how you've helped them in their lives, and also how wonderfully they were treated by your staff and yourself. You really take the time with each patient, and you understand it's not a one-size-fits-all, that every patient is unique. So it takes time, and you give that time to each patient to understand their needs and put together the best treatment option for them.
Yeah, definitely each patient is unique and they have different treatment plans.
Yeah, and that, again, you're getting the optimal results for each patient that way. And Dr. Ahmed, I want to thank you so much for joining us today. That was very informative. We'd love to have you back on the program again. We talked about some great treatment options that can help so many people.
Well, it was my pleasure. Thank you for having me today.
All right.
My pain management physician highly recommended Dr. Ahmed to help us manage my restless legs, which was very serious, and making it so that I couldn't get rest at night because I have chronic pain conditions that really compounded my situation. So Dr. Ahmed handled that so simply by just changing the dose of the medicine I was taking and what time of day I take it. And it's made a huge difference. And while we were doing that, through our discussions, he was able to also diagnose me with narcolepsy and carpal tunnel. And that has made the biggest difference of everything. So those three things have really changed my life, like a 180 kind of turn now. I'm so much more functional. I had a nerve conduction test on my arm and wrist to diagnose me with the carpal tunnel syndrome. And it's really simple now. I wear a brace while I'm sleeping at night, and that I think just relaxes the muscles enough so that the next day I can use my hands so much more than I did before. I can type again and use the mouse, and I'm able to sew, which I hadn't been able to do in years because I couldn't grip the needle. And then with the narcolepsy, I did a sleep study here in his office, and they were able to test to see if how deeply I was sleeping and if I could fall back to sleep after just waking up after 8 hours, which of course I did. So that medicine allows me, that he's given me for that, allows me to stay awake during the day, which I used to struggle with, barely could keep my eyes open. And again, that's just completely changed my life. Dr. Ahmed is really lovely, and he has a great bedside manner. He's very relaxed, and that makes it easier for me to talk with him and explain whatever symptoms I might be having. So I really appreciate his personality and obviously his expertise, because it was not difficult for him to pinpoint exactly the extra conditions that I had on top of my chronic pain. And he was able to help me with it so simply, because I've had these conditions since I was 19, so maybe 30 years, and he's the first one to realize that it's the narcolepsy that prevents me from staying awake and alert. All the other doctors just said, well, you have chronic pain, so you're going to be tired. But he knew that it was more than that. So his expertise and his ability to diagnose, I think, is the number one reason to recommend people who are suffering. And then I think his office staff is lovely and easy to work with. And that's a big deal when you're seeing a lot of physicians. You really need to be able to communicate with the office.
Yeah, I was just having a lot of kind of like muscle issues, nerve issues in terms of a lot of twitching, numbness, and whatnot, in various kind of my arms and my legs. It was an ongoing problem for a number of years, and I kind of literally kind of Googled and typed in top neurologists in Montgomery County, Maryland, and Dr. Ahmed's name popped up, and read some testimonials, and I've been with him for I think 5 years now. So it's been a great working relationship, great doctor-patient relationship. So I speak very highly of him. I've gone through the gamut, a lot of various testings of EMGs, nerve conduction tests. I've definitely felt a lot better in the last couple of years with dealing with Dr. Ahmed. They're the best. The staff behind the scenes always willing to try to fit you in, so they're all willing to kind of accommodate your schedule, and it's just been a great. I can't again highly recommend them.
Well, since I was a child, due to various things, be it I'm also allergic to bees, so bee stings, falls, even an asthma attack once. I'd had seizures, and it was always, I guess, considered to be relative or related to a certain issue. Like I say, bee stings that I had an allergic reaction, or the fall was head injury. But as I got older, these continued all throughout life, and it was about probably 8 years ago that the doctor first, said, hey, maybe you have epilepsy, and then they proceeded to do a neurology or some type of brain scan, brain testing and sleep study, and from there I found out I had sleep apnea and also epilepsy. So come to see Dr. Ahmed. I've been a patient here for about, let's say, a little bit over 3 years. Since I've come here, I was having seizures to the point where I would stop breathing, and or they were just occurring frequently, or I was just noticing that they were just a little bit more frequent than I was comfortable with. And so after explaining all my symptoms to Dr. Ahmed, he took the time to kind of do a brief medical history and everything, and just go into detail, and also I guess look into and follow up with any of the other issues that were related to that, and treat me for my epilepsy. Now we're to the point where I'm not having barely any seizures at all. It's made me feel a lot more comfortable. Due to the fact that when you're having seizures to the point of not breathing, and that's a little bit serious, very serious. So it's given me a sense of a lot more stability and comfort in life. Dr. Meadows is a great doctor. and he takes the time to get to know his patient on a personal level. He has been and he's always been very accommodating with me and made me feel very comfortable. He's generally somebody who I actually would not recommend, but I have recommended to people in the past, and have said, hey, this is one of the best doctors I've ever had, and you probably should make sure if you have neurology issues, you should definitely make sure you see him.